Hey, welcome to Health or Hoax. This is the third and final video in a series of 3 videos exploring the Lancet papers on low back pain. The first video was on the sort of understanding of the condition, what causes low back pain, etc. The second video was on various treatments for low back pain and what types of treatments work, what doesn't work, when does what work, for who. And this third paper is kind of a summary and sort of a, well, what do we do about this? This is a global issue, and there are a lot of ways that we need to tackle it. So as I was joined by Dan and Blake in the previous 2 videos, as am I today. So we're going to start off by quickly giving a 10-second takeaway from the paper in our own words. I will start off. So in 10 seconds or less, this final paper, which is titled "Low Back Pain: A Call for Action." 10 seconds or less. I think this is just a summary. There are a lot of different ways that we need to tackle this issue, including, educating the public, educating providers, and implementing policies, etc. So this is sort of a how-to. So I think that's if you want to come up with ideas of what to actually do about it, this is the place to go.
Yeah, I would say my biggest takeaway was that this is an important issue because it is the leading cause of disability in the world. They reiterate that. And it's super complicated. Like, you hear all the time on whether it's from healthcare providers or just random people on Instagram and Facebook, like, here, fix your low back pain in 5 easy steps, or here's the one weird trick to fix your low back pain. And it's just probably not the case. Like, it's a complicated thing that requires like a lot of collaboration, and that was my big takeaway.
Yeah, my big takeaway is the need for more involvement in legislation parameters. So I know with the chiropractic realm, we have the Minnesota Chiropractic Association, where they have a day at the Capitol. They go to the Capitol and talk to people about legislation for chiropractic in many different ways. The AMA, I'm sure, has days like that as well, and other professions. And so I think one of the biggest things is get involved. Like, start pursuing some of these things. Start providing case studies for researchers to look at the proper effectiveness of that specific treatment that you used within that case, right? So it's definitely do something now. Here's a list of things to do. Let's go and do it.
Cool. All right. I am now sharing my screen here. You should be able to see it. Yeah?
Yep.
Cool. Let's close this up. Here we go. And I'm going to zoom in just a little bit here. Oh, that looks like a little too much. Let's go back here. All right. Cool. So low back pain, a call for action. Well, let's just take this page by page here and give the main highlights. So I start on the very first paragraph. I started highlighting, and then I was like, "Oh wait, this next sentence is also really important. Oh wait, this next sentence, this whole freaking paragraph." So I'll just read it.
Highlight the whole paper.
Yeah, honestly though, most of it.
Yeah.
So okay. Prevention of the onset and persistence of disability associated with low back pain requires recognition that the disability is inseparable from the social and economic context of people's lives and is entwined with personal and cultural beliefs about back pain. Health and workplace policies and disability payment systems are often ineffective and wasteful, and they are key targets for improvements. Socioeconomically disadvantaged people are overrepresented among those with disabling low back pain. In many settings, they will be further disadvantaged by restricted access to accurate information sources, healthcare approaches that provide appropriate support for self-management of uncomplicated low back pain, and to specialized effective interventions such as multidisciplinary rehabilitation for complex, persistent low back pain. That was a mouthful. Guys, what did you put that in your own words?
You can go, Dan.
Yeah, I mean, people who have less resources are going to have more pain because they don't know what's going on with them, right? I mean, that's essentially what it's saying, is that everyone is going to perceive that pain differently depending on their religion, depending on their area of geographic living area. I mean, there's just so much that goes into low back pain. And for those with a lower income, it seems less attainable to ever be pain-free. I remember some stories that my grandpa used to tell me of when he was in Ethiopia, of just people just extremely disfigured and uncomfortable and just always complaining of how much pain they were in. And it's just it's not accessible to everyone.
Yeah, I agree with you on the comments about socioeconomic status. The other part of it, and it talks about it not being separable from like social context and whatnot. And I think, at least in my experience shadowing mostly chiropractors, like that's not really addressed very often. Like people don't get asked about like, what does this pain mean to you? What is it preventing you from doing? What does that mean to you? Like those are all really important things. And like I would think that should, and I think this paper supports me, that should shape your treatment. Because like if what gives my life meaning is picking up my kids, then that's what it should be focused on. If what gives my life meaning is, running a marathon every 3 months, then you should focus on that. Like you need to know kind of where the goal is to be able to treat the back pain.
Yeah, absolutely. So that's a person-centered approach for sure. I think a lot of times, we are chiropractic students, but it's not just us, right? Chiropractors, physical therapists, massage therapists, acupuncturists, whatever, get really hung up on. I think they probably enjoy providing certain therapies. There's probably some fun in it to crack someone's back or do some soft tissue stuff, do some manual therapy with your hands on a person. So there's probably some a lot of buy-in from providers who really just want to give a therapy. They just like giving it, whether it's going to help the person or not. So maybe we can overcome that a little bit. Now this is crazy. This is just a really succinct way of putting it. We said this a lot in the last video, but disabling low back pain is partly iatrogenic. You would think that hopefully in a system that's working, that's not broken, then you would think that people who have better access to healthcare will have less pain. However, exposure to healthcare can sometimes have harmful consequences. Such negative effects of healthcare reflect a change in views from low back pain being a fairly benign part of life to it being seen as a problem requiring medical attention. So if people see their doctors tell them all this horrible stuff that's happening in their spine, they freak out, their beliefs about back pain change, and then they become disabled. So let's not do that. I mean,
Right.
You want to just quick define what iatrogenic means?
Yeah, I was about to say.
Yeah, the word iatrogenic just means that it's a condition that's caused by the doctor. So just kind of it's almost it's in a way it's almost like the opposite of a placebo, kind of, where and I'm really playing loose with my terms here, but essentially where a placebo is something that is this intangible benefit to the patient that's not actually related to the exact treatment being given. An iatrogenic illness is an illness that you wouldn't have had if you didn't go to the doctor.
Right. Yeah, I would agree with that. It's any condition that healthcare intervention has induced. Yeah.
So some key messages that are being put forth here. We want to use this positive health notion, which is explained in a page coming up here. So we'll wait for that. Avoid harmful and useless treatments, which is hard because in our education, and man, I used to think that it was just chiropractors because man, chiropractors have we get a bad rap, and frankly for good reason, because our education is in some ways very good, but in other ways really, really behind the times. So I thought it was just us. I thought it was just chiropractors, but it turns out it's medical doctors and physical therapists, occupational therapists, whatever. We're all missing the boat in this regard and giving harmful messages. So we need policy, public health, healthcare practice. We need social services and workplaces that are working together over the low back pain paradox, which especially in low and middle income countries is a problem. So jump in at any time, guys, if you see something that you want to talk about. The political challenges, obviously we have to have worldwide organizations like the World Health Organization who could help to really bump low back pain up on its priority list and address these issues nationally or internationally, globally.
Mm-hmm.
I think that people don't understand that low back pain is such a big issue. It's just, some people, think that it's just, it's low back pain, it's whatever, you see your doctor, take care of it. But it is, again, keep reminding people, it is the number one cause of disability in the world, and it does not need to be. We're just treating it wrong.
Right, and like I mentioned before, I mean, get involved with your local state organizations too. A lot of your, at least in the United States, a lot of your scope and what you're allowed to do and what's put forth for the public is determined by your state legislation. At least with chiropractic, each state has a slightly different scope, and so if you're looking at getting involved in this, just go talk to your association, state association, see how you can get involved. Just really go do something about it.
Agreed. So there's public health challenges. Public health, we can help to address some modifiable risk factors. So obviously, let's address the things that are within our control and recognize the things that are out of our control. And if we set up an environment for success, then people are more likely to sort of, the low back pain is sort of an issue that can take care of itself if we provide the correct environment for people, provide the right education to stay active, remain at work if you can, adequate education, promoting a healthy lifestyle, and then providing, and not just promoting it, because it doesn't do any damn good to promote a healthy lifestyle in a community that doesn't have the resources to live that way. If you're working 3 jobs and taking care of 3 kids, how are you going to live a healthy lifestyle? So we need to take care of people in other ways that don't seem like they're related to low back pain, so that people actually can live a healthy lifestyle. Because otherwise what happens is you promote this, hey, you just need to pull yourself up by your own bootstraps and go exercise, go for a run. What are you, lazy? And then people just feel worse. They feel worse about themselves because they can't do it. They don't have the time, and they legitimately can't afford the time or the resources to eat healthy, to move, to whatever, to buy a standing desk, whatever. They can't do that. So we got to provide. We need to provide that environment for them, and not shame people. Some suggestions to provide financial incentives for returning to work, as opposed to financial incentives to stay home and be on bed rest. And then have multidisciplinary rehabilitation where we're working together with, between our different professions, and not just healthcare professions, but also, in public health and all that, and educational systems and government systems, but all of us working together. The healthcare challenge is that we have crappy education. our school, I mean, we, all three of us are in school right now, and we are being taught a lot of things that are in direct contradiction to all of the best evidence-based guidelines on caring for low back pain. Not everything we're being taught is a lie, but a lot of it is misleading, and I think it leaves us with the impression as students that people with low back pain need to take it easy, stop moving, have passive care, have care that doesn't work, that's been demonstrated to be ineffective. So, educating us.
I would say this is probably an issue across most healthcare education. I'm certainly like one. I would guess. I've never gone to medical school, obviously, but I would guess medical school is probably the best of the bunch. But like, even there, like, you need to learn how to critically think and like critically analyze information and figure out if this like fits within a logical framework. And I don't think any schools necessarily teach that. It's literally just practice, like read research. Don't believe everything your professors tell you just because they're talking at you. Like,
I just want to push back against what you just said a tiny bit, Blake, that that medical school might be the best off in this regard. Obviously, medical school, if you go to medical school and you take a biochemistry class versus the biochemistry class we take in chiropractic school, it's not apples to apples. They have higher standards.
Yep.
And it's not that our standards are crap, but they do have higher standards, and we need to be humble about that. However, at least with regards to low back pain, when you look at the statistics, when you see that specifically opioids and in spinal injections and surgeries are either completely not recommended ever, or they're only recommended sometimes in limited situations, and you stack that against the statistics that show how often they are prescribed as the first and only treatment. I mean, I would have to guess that in school they're being taught to treat low back pain in that way, with pharmaceuticals, with injections, with surgeries. And maybe that speaks mostly to the fact that it's like, what do MDs get trained? What do they have more specialized training than anybody else, than physical therapists or chiropractors in? They know way more about pharmacology and surgery. We don't know that stuff. What do we know more about it than anybody else as chiropractic students? We know more about joint mobilization. And what do we do more than anybody else as a treatment, whether it's advised or not, whether the evidence says we should be doing it or not? We just manipulate because that's what we know how to do. So we're not thinking, and what do physiotherapists do? They're going to do soft tissue stuff and electrical stim and ultrasound and things like that, and and then hopefully exercise. That would be in line with the current evidence. So I think we need to step the hell out of our biases and step the hell out of what we're good at and actually read.
One thing is with my point of, you need to learn how to critically analyze things and become a better thinker and be okay with letting go of some of your biases, like you said.
Yeah. One thing, Blake, to your point, I would agree that within medical school, they probably have the best funding and the most research on things. So I think they have a greater access to things that they can look at to come to the best conclusion. And so chiropractic, I mean, within chiropractic, you always, with any profession, but chiropractic, what an adjustment actually does, the research is low for us to actually
That's true.
get an answer for that sort of thing.
I don't know. I guess I think the utility of this kind of conversation is just like knowing the strengths and weaknesses of other professions within the healthcare system. At least for me, I think would foster more collaboration and like, certainly no benefit comes of blanket statement like shitting on other professions.
Right.
Yeah. Right. So yeah, that's that build. This is just moving on and things I highlighted is build consensus. Yeah, build some consensus across the different disciplines and enable people to see the right person for the delivery of the right treatment at the right time, because all of us have something to offer the right patient. But if we just do the thing that we know how to do best, then we're not doing the right thing for the patient. And then government interests, right? So if we can, think about this. So when I first got a handout seeing what chiropractors are reimbursed for in terms of insurance, and it appeared to me that, for example, Medicare basically doesn't pay chiropractors to do anything other than crack backs. That's crazy, because we do have training in so many other things. And then you wonder why so many chiropractors, you just walk into their office, they crack your back and send you on their way. Well, the financial incentives, that's what they're paying for. And so I can see why people might fall into this trap of like, well, I don't get paid much to do manual therapy. I don't get paid to prescribe exercise, which is the most evidence-based treatment, the most heavily mentioned thing in this series of 3 papers, is that you got to stay active. And here we are, we don't even get paid by Medicare to prescribe exercise. Well, no wonder people aren't doing it. I'm not saying that excuses them. You still should be doing it because ethically. But if the government they weren't paying for if we aren't giving the right treatment, we shouldn't get paid. And if we are giving the right treatment, we should get paid. Bottom line.
Yep.
More incentives to use the right care. Same with funders, people who are funding research. Try and fund research, and in ways that is in line with current evidence, and fund just in general. This is funding for colleges, funding for whatever. This is something that just drives me absolutely bonkers, is that we have so much funding from people in our in the schools, because the schools are private, and we get funding from people who are just trying to promote their own self-interest, their own outdated dogmas, and then the school is kind of forced to continue to teach things that are just bogus. Oh, here's this positive health idea. Okay. So the term positive health,
this is good,
is the ability to adapt and to self-manage in the face of social, physical, and emotional challenges. So the paper says that we should be, as providers, or as for us future providers, promoting the idea of positive health, which is the ability to adapt and self-manage in the face of social, physical, and emotional changes. What do you guys think about that?
I think that ultimately that would be the goal with every patient, right? Like, you'd want them to eventually be able to take care of themselves to the best of their ability. I think that one trap, at least like that I see some of our other students who we talk with a lot fall into, is like, that might not be realistic for that patient immediately. Like, you might need to like walk with them for a while. Like if someone's never exercised before and their shoulder hurts, like maybe me adjusting their shoulder once or twice and then doing some soft tissue work is the stimulus that then makes them feel comfortable to go exercise. Granted, like, I need to be like encouraging that exercise all the while to continue to push them towards that self-efficacy. But like, they might need, different people probably need different motivation, I guess, would be the biggest point. And I think just blanket statement, like a lot of more evidence-based chiropractors, like, don't adjust or don't do this. And I think throwing those tools out is kind of arrogant, because it might be something that like really helps somebody.
Yeah, to your point, Blake, like, it's, I'll say this a lot because I like the word, I like the words, but it's a self-limiting belief towards your patient. As soon as you don't think your patient can do something, you've now limited their ability to heal. And one of the things that Rachel Balkovich talked about recently was like, prepare your patients to fail. Like, the first step to success is to prepare your patient to fail, right? If they are expecting failure, they're not going to be disappointed, A, with their treatment. B, they're also going to be like, all right, I know that this is part of the process. Let's keep moving forward. Let's manage this better, and let's kick its butt, right? If you can
Yes.
motivate your patient to do that, I mean, that's the best way to get people better.
So you're saying just setting realistic expectations?
Yeah, setting
Being like,
realistic
it's okay.
expectations, and then don't limit what they can do.
Sure.
So there are just to keep moving here. There are a lot of people that are promoting an idea that essentially all treatments are basically the same, and it kind of doesn't matter what you do. Treatment of low back pain is basically a psychosocial sort of thing, and they start to ignore the contributors of specific biological events. And at least that's how it comes off sometimes. And just to point out to this group, which I largely agree with, but just to kind of push back against that mentality, so right here, the importance of behavioral approaches to back pain management does not preclude the continuing need to investigate mechanisms and potential biological determinants of nonspecific low back pain in phenotypical distinct subgroups. So just because we have a lot of new information that's it's actually not even that new, but just because we're really starting to it seems like more commonly embrace this idea of psychosocial sorts of contributors to low back pain. That low back pain is complex. It depends on the person, their body, but it also depends on their mental frame and their environment and their social context. But that we can continue to investigate specific things, because there's no way we've reached the end or the sum total of all knowledge about low back pain, right? This is an ongoing investigation, and so we should continue to be curious, I think, about trying to get even better and get even better at our approaches. Anyway, but that in the meantime, we can continue to educate and all this stuff that results in the public and in patients maybe having a different expectation, and they might be less likely to expect a really, really laser specific sort of diagnosis or a complete cure. They might be more willing to accept this positive health idea of, well, look, the goal here is not to tell you exactly what fibers in your body are the exact fibers that are quote unquote damaged. Maybe they are, but that's not the goal. The goal here is to get you to be able to take care of yourself.
Yeah.
This is an important quote. This is really important. I found this. Passive approaches such as rest and medication are linked with worsening disability, whereas active strategies such as exercise are associated with reduced disability and less reliance on formal healthcare. Go ahead.
No, it's good.
Another blurb here just saying, hey, guys, we really need to educate providers better. Chiropractors, physiotherapists, everybody, we really need to do some training for doctors that are out there trying to help patients. They think they're doing their best, but they are doing exactly the opposite of what the evidence is suggesting that they do. So we need to train people better.
I think along those lines, I don't know if there'll ever be someone watching this who's thinking about going to medical school or chiropractic school or PT school or anything like that, but I think accepting the fact, at least for me, accepting the fact that I will not be taught everything I need to know, or even close to everything I need to know to be a good provider within my program, was very liberating to me. And I need to go on my own and find other resources like these papers or other groups or podcasts or books or to supplement my learning. Because ultimately school's jobs are kind of to get you to pass your board exams, from what I definitely within chiropractic school.
Yeah, they just need to get you to get your license. That's their main concern. Because if they fail that, then they fail.
Right. And I think I have friends in medical school, and it seems like the same for them. Like their job is to teach you how to pass step 1 and then get into a good residency program. So like you might need to do some outside learning, and that's okay. And like
right, no matter what you do, right? No matter what program you're in, that's what you're saying.
Yep, that's the point.
Yep.
Yeah. Yeah, I think I agree with that because I had a lot of reservations against going to chiropractic school in the first place because I knew a lot of the kind of the baggage, the dogma, the bad PR that chiropractors get and all this stuff. So I was a little nervous about going to chiropractic school because I thought I was going to get taught. I thought I was going to show up and it was going to be like freaking Hogwarts, just a bunch of witch doctors. And there are witch doctors. That is a real thing, but and that's unfortunate. That really sucks. But it brings me some peace of mind to know that no matter what profession I entered, hell, even if it's not a healthcare profession, if I entered, I don't know, if I wanted to be an electrician, I bet when you go get, to a vocational school and learn how to be an electrician, I'm sure there's stuff that you learn that, a lot of people disagree with. There's going to be controversy in any field. Carpenters, no, this type of joint is the best joint for, whatever. It's like, I don't know. There's no matter what you're doing in life, it seems like the best strategy is always to continue to question everything and try and drive the needle forward. The last thing that I highlighted on this paper was just a little blurb that's, again, another mention that, hey, using really sensitive imaging like MRIs or even X-rays can reveal findings that might be incorrectly inferred to be the cause of a person's pain. So again, despite how it might seem surprising, especially for patients who might, people who aren't healthcare providers who might be listening to this video, it might be surprising to hear that actually getting an X-ray or getting an MRI is not recommended in most cases. Not, sometimes it is, but mostly it's not.
Yep.
Yeah. Anything I missed, guys?
No.
Cool. Any closing thoughts? Anything that you wanted to say?
I liked your point about just like it, especially from like a provider standpoint, like just keep learning and keep trying to get better yourself and bounce ideas off of other people, because if you don't do that, you're more likely to develop some wacky idea. Like don't live on an island. Don't degrade other professions, because like I really appreciated this paper series because it really it talked about, I mean, primarily I think it talked about medical physicians, but it also mentioned PTs and chiropractors, and like we're all trying to help this situation. Right.
Yeah. Go ahead. Sorry, I didn't mean to interrupt.
Yeah, and just working together is the best way to do so. And there are going to be amazing practitioners and shitty practitioners within every profession.
Yeah. And for those out there who have thought one thing and these papers have changed what you're thinking, it's changed my thinking a ton. It's okay to change your thinking. I mean, back to Anthony's point of always learning, right? Like it's okay to think something that was wrong 5 years ago, right? It's not a problem. Yeah, no. As long as you admit that it's no longer a thing and move on, that's all you can do in life as a practitioner, as someone who's helping people. So don't be afraid of that. It's part of life. It's actually one of the fun things about life if you learn new things. You're like, oh, that's cool. That's something different. That's something new. So don't be afraid of that.
Cool. Yeah, 100%. That's kind of my motto in life. Be wrong as often as possible. It's also the motto of science, though, right? Is just try to constantly prove yourself wrong.
Yes.
And if you keep really earnestly trying to prove yourself wrong about something and you can't, then maybe you actually found something that's closer to truth than I guess you would have otherwise been. So you've got that. I don't know. Anyway, I think this is a really important series of papers, and if people are listening and you've got comments, it'd be really interesting to hear, especially from providers. We're students, so if there are providers listening, I'd be really curious to see how you would implement this stuff. If this is a little bit different than the way you've been practicing, I mean, how would you personally go about making a difference? Because there's a lot of change that needs to happen from the policy, the government's World Health Organization. The schools need to change. The trainings implemented, public education, public health interventions. Man, where does a person even start with that? So if you're listening, what can you do? You personally, even if you're a chiropractic student, what can you do? There's probably something. So. Cool. Thank you guys for joining me. Thanks for listening. Like, subscribe, do all the things. There are parts 1 and 2 that you can find linked somewhere. Thanks again. See you next time.
Thank you.